Irma, thanks for being up so early for us. We do appreciate this. Look, the timing of the surge is unfortunate, just as Indonesia was hoping to open up. Could they not have foreseen this could happen given the trend globally?
Well, yes. First of all, thanks for having me. Yes, actually, we could anticipate what is going on right now. If we could see right now, we have seen the increase in the cases, hospitalizations, and also, well, the government is actually now is increasing the testing as well. But actually, I feel like this is a little bit late because we kind of like we should have anticipated before December, the Christmas, the New Year's, and when we could predict the mobility of the people normally increase during that times. But unfortunately, at that time, we could see that we kind of like lift up social restrictions. But as a result, what we are seeing right now, everything is showing increasing trend.
Yeah. I want to pick up on what you talked about there, just increasing hospitalizations. Now, this is interesting because I'm presuming this is an Omicron wave. I mean, you had the very severe Delta wave last year, but this is a mostly Omicron wave?
Well, at least the government of Indonesia have. I'm glad the government have declared that we are on the third wave right now. And when you go on the statistical data, you could see we are really riding on the wave going up. And then specifically in some places, like in urban places, like in Jakarta right now, it's a little trickier because many people showing light symptoms. But when you go to the hospitals, just actually recently, we also helped a few patients who are already admitted at the hospitals, and then we're still have a difficulty to find an ICU for them. So this shows, I mean, this is kind of like a bad sign for the ICU occupation rates in the capital cities, but we'll see. We hopefully the government would increase the bed occupation rates, but also it raised concerns. We were told that Omicron's effect is less severe as Delta, but on the ground we could see severity is actually also going on for some particular people, I mean, some group of people. And when you track back in early January, when we found the first cases of Omicrons, not long time ago, a few days later, we also the government also declared that two or three people died due to Omicrons. And then the next few days, 5 more people died when the cases were still very low. I mean, this shows like a bad signs on fatality rates.
Yeah, it's not good at all. The vaccine mostly in use is Sinovac in Indonesia. Do you think this is a factor with the severity of what people are experiencing at the moment?
I think this is part of what we are still learning about the effectivity, efficacy of the Omicron, whether Omicron gives sufficient, of Sinovac, whether Sinovac gives sufficient protections against Omicron to us. Our governments were too confident previously that we had reached a level of, herd immunity due to the immunity given by the Delta. But again, this Omicron's, this variant has kind of like different characteristic. And then I think there are at least 3 studies from University of Hong Kong and then Yale University and the Minister of Dominican Republic, Minister of Health in Dominican Republic. I think they also published a research that consistently found that there is less protections that is given by Sinovac against Omicron. So I think we are still learning about this. we haven't had a better and full picture about this. We'll see. But for me, I think we cannot. I mean, the government really need to protect the lives of their peoples. I mean,
Yeah.
by not it's not a good idea to reopen the school, to reopen tourism, to reopen everything. So must be restrict again everything right now.
It looks like that may be the direction they're going in. Irma, always appreciate your insights into this. Thank you so much.